Thanks very much, and thanks very much for asking me to come along and talk today. So what I'm going to talk about is the importance of evidence for practice. One of the interesting things is that in Wales we've got a different NHS system. I don't know how many people are from outside Wales here today. Great, and how many people from Wales today? Oh, good, a small minority, but yeah, a healthy one as well. So we've got a different health system, which is quite interesting actually. So the same issues apply that we just heard about, the rising costs, the need to work differently, the need to use evidence to inform our practice moving forward. But one of the things that the Welsh health system has become based on is something called prudent healthcare. So this is a relatively new initiative and one that's gaining a bit of momentum, I think, in the rest of the world. And I think that most of us, or wherever you are, would agree that the principles are fairly central to what we'd all aspire to do. To me, they're pretty much common sense. So public and professionals are equal partners through co-production. So this is very much about putting the public at the centre of the delivery of healthcare and social care as well. Care for those with the greatest health need first. So clearly we do need to prioritise to a degree, and we should be prioritising according to health need. I mean, we heard mentioned before on the slide about poverty. I mean, it's no good actually prioritising healthcare as to who's got the most or the least money. It should be according to who has the greatest needs. And this inequality gap across healthcare is really stark. People with more money actually tend to get better care. There's a lot of research that shows that at the moment. Do only what is needed and do no harm. So this is quite a challenge, really. It's saying that one of our responsibilities as clinicians, as practitioners, is to do no harm to the people that we are treating. I'm sure we'd all agree with that. But doing only what is needed, so trying to do what's measured, what's required, rather than, sort of spending an awful lot of resources on things that aren't actually needed, because obviously that takes away from what we need to provide for others. And when we've got a limited amount of money in the system, we do need to make these decisions. It's also really important to determine what people feel is needed and what people want, which goes back to the co-production element of this. And then finally, reducing inappropriate variation. It was really interesting hearing about the compression bandages. I mean, my assumption there, and I'm sorry, psychiatrists, I'm ignorant to wound healing to a large degree, is that really the evidence shows that applying compression bandaging to venous ulcers is the best way forward, and I'm assuming that's a research finding. And so really what we're saying here is reduce inappropriate variation. If that is what the evidence says, then everybody with a venous ulcer should be getting that treatment across the UK, internationally, across the world. So using evidence-based approaches is critical to reducing inappropriate variation. Groundbreaking research discoveries definitely result in novel and innovative ways of preventing and treating illness. I mean, in wound care, I'm sure there are loads of different discoveries through research that are really impacting on the delivery of care that you develop. I mean, my brief reading around this in preparation for this, silver-based dressings, is that true? That's an evidence-based finding, that silver's good for wound healing? No? It's rubbish for it, is it? Who thinks silver's helpful? A few? I mean, there seems to be a lot of products that are based on silver out there that you can buy. So you can see some of the dilemmas that we get into when we're applying evidence. I mean, what we should be able to say is what is the truth in terms of silver and wound healing. We need, if there isn't research there at the moment to determine what's right and what's wrong, then we need to know that. What about larval therapy? Is that helpful? Yeah, more people agree that larval therapy is helpful than silver dressings, but there's the odd shake of the head as well. So it's quite interesting, isn't it? You're a group of experts here, and we've got a bit of disagreement as to what is evidence-based and what isn't evidence-based. And actually, often it's that's not surprising. It's quite difficult to gather and synthesise all of the information, and it may be that these things are helpful in some instances, but not in others. I also think actually that a lot of us tend to practice according to what we found to be useful over time, and that's we need to be a bit careful about that judgment because new things do come along and the evidence can change. What about hyperbaric oxygen chambers and things like that, putting people into hyperbaric oxygen? Is that a good one? There's loads of advertising for that, and I've read several papers about this in wound healing over the weekend, so again, interesting. So anyway, evidence-based decisions allow resources to be focused where they will be most effective. But I think this little discussion has outlined that actually just having research isn't enough. Looking at one study and the findings of that isn't enough. We need to be able to synthesize information and then present it in an accessible format and then transfer that research information into care, so-called knowledge transfer, knowledge mobilization. Improving the effectiveness of services and how we configure ourselves, how we set ourselves up is really important. I mean, in my years in mental health, I've seen massive changes actually in wound healing and wound care. In Wales, I've done quite a lot of work with Keith Harding over the years. My background is in liaison psychiatry, so dealing with individuals with medically unexplained symptoms, for example, has been a key thing. I've got a particular interest in factitious disorder, which is quite an interesting one in some non-healing wounds, actually. But the Welsh Wound Innovation Centre is a way that Welsh Government, along with other partners, has funded a new innovative way of approaching wound care and trying to bring new innovations into practice. So that's a good example, I think, in Wales of transforming services through high-quality research and trying to facilitate excellence. Wound care in terms of treating wounds and the visibility of wounds and helping reduce the impact of scarring, I think, is something that has improved, certainly over the years. And I guess the military are quite at the forefront of some of the work in this area now with the type of wounds that have come out through some of the recent conflicts. And then I'm a strong believer in dynamic and innovative R&D culture, actually supporting effectiveness of services, but also improvement work. I think that having a dynamic and innovative culture creates a better environment and helps us to develop staff and also to recruit and retain staff in areas. I mean, as far as I can see, wound healing has become quite an attractive area for a lot of people to go into and have a closer look in. I think one of the reasons it's been a Cinderella area, probably still is, like mental health, is that it hasn't been felt to be as attractive as some of the other areas. And it's up to people like ourselves to really raise the visibility and increase the attractiveness of that. And by showing that we're basing our decisions on research evidence and showing that we've got evidence-based effective services, I think is a really good way of doing that. Finally, wealth generation. Rarely have I come to a conference where there are so many different stands actually around and about the place. So clearly wound healing is contributing greatly to wealth generation. I mean, hopefully in an appropriate and a productive manner. In Wales, we've got several companies based in Wales that have been attracted to Wales by the environment that we have to do collaborative work across the NHS, with academia and with industry working in partnership together. And as I said before, the Welsh Wound Innovation Centre is a good example of that. But there are several ways that we can develop wealth, and obviously it's only by developing wealth in countries that the governments get the income in to support the NHS and to help it to grow ultimately. So Health and Care Research Wales, which is the organisation that I direct, is a national multifaceted organisation, and we're the equivalent of the National Institute for Health Research within England, but for Wales. So we are very much NHS facing. In fact, in Wales, one of the, I think it's an advantage, although I guess there would be some disadvantages as well, is that our minister is the Minister for Health and Social services. So actually that does help a lot, I think, with the integration agenda. We are Health and Care Research Wales because we cover both healthcare and social care in the funding that we deliver. So we have an infrastructure, which I'll describe briefly, and also a range of different funding streams to encourage research to take place. A lot of the schemes that we work with are also available through the NIHR in a similar form, or we buy into several of the NIHR schemes. And I think, hopefully several of you in the room are involved in seeking funding and hopefully winning funding from the NIHR. Is that true? Are there people in the room with NIHR funding? Fantastic, great. So a few people in the room. So we're funded and overseen by the Welsh Government, and then we support translational research with a particular focus on applied and public health research, which I guess is very much in the area of most people in the room. So prevention, totally agree that prevention is really important moving forward, as is detection and diagnosis of disease. Then the development and evaluation of interventions is what we're very keen on, and I think that's really important. I mean, we fund work in the wound healing area, and it's really important to know if a new intervention on the block does actually help with wound healing or not, and therefore setting up studies, for example, randomised controlled trials, is a really good way of doing that. We fund research into the provision of services and also the implementation of research findings into practice, so this knowledge transfer, the knowledge mobilisation end of things. Our vision is for Wales to be internationally recognised for its excellent health and social care research that has a positive impact on the health, well-being and prosperity of the people in Wales. And I'm sure the NIHR would aspire to do that in England, and in Scotland the Chief Scientist's Office would aspire to do that, and in Northern Ireland we have colleagues in the Northern Ireland office who are funding similar initiatives in Northern Ireland. We all work very closely together and have meetings between England, Northern Ireland, Scotland and Wales to make sure we're on the same track. A key thing for us, and I think a key thing to drive research forward in the future, is that the public should be right at the very centre of research development. So we need to know what matters to the public. The public need to inform us as to what we should be researching so that we actually deliver what is needed. So we've reconfigured our organisation recently and put the public at the heart of it. We have 5 different sort of sectors, in a way, that we're trying to deal with and ally with strongly. So that's social care, health through the NHS, universities, industry, and also the third sector, who are absolutely critical to driving the research agenda forward. We fund a range of different initiatives, including a support and delivery service. The same applies across the United Kingdom, that there is a separately funded delivery service for research. So if you have high-quality research that you're conducting, you should have access to a network of professionals who can support you in that. So, for example, we have nurses that we fund who go in to recruit people into wound healing studies within Wales, and the same should apply in England as well. We fund research centres and units, which I'll describe briefly. A range of different grant schemes for developing researchers and established researchers, clinical trials units to help with the design of trials. This applies again in England, Scotland and Northern Ireland, but people who are employed by the NHS can go along, book an appointment with these people who are experts in the design of studies. So if you have an idea for a study, you can go along to a research design service, as they're called in England, or the research design and conduct service in Wales, and sit down with a methodological expert who will give you advice as to how to, for example, compare one dressing against another dressing, or whatever the research question is that you're trying to look into. We also fund health economics to look at the cost effectiveness of services, which is really important. We have genetics that we fund, and also a secure anonymised information linkage data bank. Big data is becoming very big, for want of a better word, or to avoid repeating myself in this. But linkage of data from all different sources is really important. I mean, what's really important in knowing what causes and maintains wounds is the other aspects of people's lives. So knowing about people's lifestyles, I'm sure you'd agree, is very important in terms of helping to heal their wounds. And what SAIL and other big databases do is bring in NHS data so that we can then interrogate that and look at whether there are associations, for example, with particular types of wounds or wounds in particular areas. And it allows us to ask some questions that might give us clues as to what treatments may be effective in the future. We fund 5 centres and 3 units in Wales, which reflect our areas of strength within Wales. We also put funding into other areas. For example, the Wound Healing Initiative is funded through our Economy, Science and Transport division as an innovation initiative. The impact of research is something that's really important to us, and I'd just like to share a couple of examples with you which aren't specifically in the wound healing area, but they're just examples of how research can really change practice for the better. So this is one on peritoneal dialysis. Around about 250,000 people receive peritoneal dialysis, and the main complications of peritoneal dialysis are infections and peritonitis. I guess several of you will have come across infections associated with dialysis in the room. And within Cardiff University, some funding that we gave allowed people to start to look at the peritoneum and describe the changes caused to the peritoneum by peritoneal dialysis, which, not surprisingly, over many years are quite stark changes. They then, after that research, started to develop biocompatible peritoneal dialysis solutions, ones, so diacetylates that were not as harmful to the peritoneum, were more sympathetic towards it. Clinical trials confirmed the safety and tolerability of this, and this research that started in Wales showed that peritonitis severity could be reduced, the incidence reduced, and mortality reduced by around 30%. So this is a real good living example of how research that started in Wales has really helped to reduce the morbidity and the suffering that people with chronic disease suffer from, and mortality by 30%. Another example is in social care, one that we're quite proud of having funded, which is something called Developing Evidence-Enriched Practice. I definitely think that this would be transferable to all forms of healthcare as well, but this takes the form of bringing together service users, carers, frontline staff and managers to explore different elements of evidence in a workshop format. Evidence doesn't just come from research, evidence comes from the experience of people working on the front line, for example. It comes through audit, it comes from evaluating services. And basically people were asked to sit in a room together and determine which areas they felt were most important for them. So this is very much determining from the patient upwards what should be the areas that we focus on. And out of that, 6 positive evidence-based projects were developed. So positive risk-taking in dementia care. For example, for people with dementia, what risks are acceptable? You know, is it appropriate because somebody might fall that you take them into care away from their independent home? I think most of us argue, well, you need to be proportionate about this. So this is doing work in that area. Meaningful activities for older people in care homes and day centres. Reviewing professional boundaries in social care services. This was quite an interesting project, which is, applicable to lots of areas. This was professionals never telling patients or the users anything about themselves. So you'd look after someone day in, day out, and they wouldn't know, what your hobbies were, what you'd done at the weekend. And they came up with a scheme whereby you did disclose certain activities and had a chat together about what you'd both done at the weekend, rather than just the user telling you what they'd done at the weekend. And that's apparently gone down really well and helped to develop relationships further. I mean, you might argue that why on earth wasn't that being done before in some ways? Exploring how short breaks can be provided for carers, improve record keeping, and then integrating social care services into the broader community were all projects that came out of this work, and this is something that we're rolling out across Wales now. Several of the sites that were explored in that study were outside of Wales as well, so in England and Scotland. Healthwise Wales is a new national project that we've just launched in Wales, and this actively engages and encourages the public to be involved, gives people the opportunities to help us identify our priorities, and also develops a register, really, of individuals who signed up to be ready for any research that comes along in their area. So, for example, our ambition is that everybody with wounds is signed up to this initiative, and then whenever any new projects come up in the wound domain, people are contacted to ask them if they would be interested in taking part in it, rather than researchers having to go to every clinic and find out whether somebody fulfills all the inclusion criteria in their clinic. It should speed up things quite a lot. We launched this through our minister at the end of February of this year, and our aim is to recruit 260,000 of the population of Wales over 5 years. The population of Wales is about 3 million at the moment. We've had over 4,000 participants joining to date, and hopefully this will gather momentum, and I think it's the sort of initiative that would be good in other countries. There's colleagues from Scotland here. I don't know if you've heard of the SHARE project in Scotland, but that's a similar sort of a project in Scotland which is going along similar lines to create a research-ready group of people in Scotland. The thing that we'll be working to in Wales over the next years is something called the Wellbeing of Future Generations Wales Act, which came into force recently, and of all of our work now in Wales has to be around these areas. These are the 7 key pillars of what we're doing in Wales. I'm sure they're applicable to other nations in the United Kingdom, although you haven't got a similar act to this one. As you can see, a healthier Wales, a more equal Wales are 2 of the key things that we're looking for. And really, all of the research we're doing now is trying to adhere to this. So I know I've given you a bit of a Welsh slant on this. We are in Wales. I'd reiterate, we've got beautiful art next door. The Davis sisters are 2 sisters who lived in Wales, and they put loads of money into French Impressionist art, and they left it as a legacy to the nation of Wales. So that's what you'll be enjoying tonight, and you could even nip across there at lunchtime. It's all totally free. So thank you very much for your attention.